Symptoms of type 1 and type 2 diabetes. Diabetes is a condition which develops when the body is unable to handle carbohydrates normally. Type 1 diabetes and type 2 diabetes are the most common forms of diabetes affecting people worldwide. There is also type 3 diabetes called gestational diabetes, and this one can arise only in pregnant women. For this video, we will look at the symptoms of type 1 and type 2 diabetes only. Let's get straight into it. Type 1 diabetes. Type 1 diabetes mostly affects children and adolescents, and thus it is also known as juvenile diabetes. In type 1 diabetes, the pancreas, an organ part of a person's digestive system, is unable to make insulin. Insulin is needed to enable your body cells to take up glucose so that the glucose can be used by the body cells. But if no insulin is present, the glucose cannot enter cells or tissues, and then the levels of glucose in the blood starts to rise even if the cells and tissues are starving for glucose. Because in type 1 diabetes there is a lack of insulin, type 1 diabetes is also called insulin-dependent diabetes. This is why people who suffer from diabetes type 1 need to be injected with insulin so that the body cells can take up and use the glucose available in the blood. Let's now take a look at the signs and symptoms of type 1 diabetes. Excessive urination and thirst, cravings for food, especially for sweets, blurred vision, weight loss with nausea, irritability, or other mood changes. Type 1 diabetes occurs because the person's own immune system attacks the cells of the pancreas, and thus the pancreas is unable to make insulin. Some factors which cause this immune reaction are genetics, viral infection, toxins, allergens, other diseases, and a disordered immune system. Type 2 diabetes now. In type 2 diabetes, the pancreas makes plenty of insulin, but however, the body cells resist the action of insulin, also known as insulin resistance. When insulin resistance develops, glucose levels start to rise in the blood, but the cells do not take up the glucose. Thus, the cells are deprived of glucose even if there is plenty of glucose for them to take up. As a result, blood lipid or fat levels rise in a bid to provide energy for the glucose-deprived cells. People with type 2 diabetes tend to be obese. This is because insulin resistance is often associated with obesity. Obesity is believed to bring about metabolic changes that trigger the cells to resist the action of insulin. Another thing about type 2 diabetes is that it tends to be genetic. However, there is no need to worry because not every person who has a history of type 2 diabetes in the family is going to develop the disease. A person's genetics only increases the chances of the person developing the disease by, say, 30%. There are other factors such as diet and exercise which strongly affect the development of the disease. So, even with a family history of type 2 diabetes, it is possible to prevent this disease by maintaining an active lifestyle and a diet high in fruits, vegetables, fish, poultry, and whole grain foods. Let's now take a look at the signs and symptoms of type 2 diabetes. Slow healing of wounds, pain or numbness in the legs, feet, or fingers, frequent infections of the skin, gums, or urinary tract, frequent urination and thirst, drowsiness, feeling the need to sleep, and glucose in urine. The symptoms discussed in type 1 diabetes can also be shared by the people having type 2 diabetes. So, how does a person know if they have type 1 or type 2 diabetes? Type 1 diabetes affects children and adolescents and requires insulin to treat it, while type 2 diabetes tends to occur later in life and thus are diagnosed as adults. And also, a blood test can easily tell which type of diabetes is affecting a person. It is a test that measures the level of insulin in the blood after a period of fasting. The normal range of insulin is 2.5 microunits per milliliter to 25 microunits per milliliter. MCU over ml stands for microunits per milliliter. If the test results say that the level of insulin is lower than 2.5 microunits per milliliter, then the person has type 1 diabetes, and if it is higher than the 2.5, then the person has type 2 diabetes. Now, there is also something known as prediabetes. Prediabetes occurs when the person's blood sugar levels are higher than normal but not high enough to be classified as type 2 diabetes. But having prediabetes places the person at a higher risk of developing diabetes. Therefore, if a person has prediabetes, it is important to control lifestyle choices because prediabetes is reversible. And by taking action, you will keep yourself safe from developing type 2 diabetes. The signs for prediabetes are similar to those of diabetes, be it type 1 diabetes or type 2 diabetes. There are many tests available to test for prediabetes. The most common one is the A1C test, also called the hemoglobin A1C test. The A1C test results reflect your average blood sugar levels for the past 2 to 3 months. The higher your A1C level is, the higher the risk of developing diabetes. So, if you feel that you experience any of the combinations of symptoms mentioned above for diabetes, or you have a genetic predisposal for diabetes, you can share your concerns and perform the test to find out if you have diabetes or not, or if you are pre-diabetic. It is very important to manage diabetes with an active lifestyle and good nutrition because, in the long run, it can have serious repercussions on your health, such as kidney diseases, impaired blood circulations, which can lead to diseases of the feet and legs, which can result in amputations and blindness, or cataracts or nerve damage and skin damage, and even heart attacks or strokes. Lastly, with diabetes, people need to balance their diet, exercise, and medications in order to effectively control their blood glucose levels. Until next time, take good care.